Welcome back, viewers. This is South Speaks. I'm Ashish Pareek. We've got a very important discussion on our hands today. The current situation regarding the Nipah virus in Kerala has raised concerns following the detection of antibodies in bat samples from the Malappuram district. Health Minister Veena George has announced that 6 out of the 27 fruit bat samples collected near Pandikad tested positive for Nipah antibodies. This comes after the death of a 14-year-old boy from the virus on July 21. So clearly there is a lot of concern in the state of Kerala right now. Despite the alarming findings, all the contacts of the deceased have tested negative for the Nipah virus so far. A total of 472 individuals were monitored, with 261 having completed the mandatory 21-day isolation and removed from the contact list. In fact, the authorities are also closely monitoring the situation to prevent any further spread of the virus, while also ensuring public safety measures are in place. All right, so this is again an important discussion that we'll be having right now. Let me just introduce our guests on the panel right now. Dr. Rajeev Jayadevan, who's a Vice Chairman of the Research Cell of IMA Kerala. Dr. Ishwar Gilada, Secretary General, the Organized Medicine Academic Guild, and also Jisha Surya, who's a journalist. I appreciate you all for taking your time out for this very important discussion right now. Let me start with Jisha Surya right now. Jisha, again, a lot of concern about the Nipah virus, and as it always has been from Kerala. Help us understand what's the current situation like right now, because again we see a lot of alarmist reporting as well across various outlets, but help us understand what exactly is the situation on ground.
This is the fifth outbreak since 2018. But as far as I understand, the Nipah scare this time has waned away. Unfortunately, we lost the index patient. It's a 14-year-old boy from Malappuram. But after that, no one has tested positive for this Nipah virus. And half of the 470 persons who were in the contact list also has completed the 21-day isolation period. So currently, the Nipah scare has waned. But this is the latest report that has come up. The antibody presence was detected in the bat, but health experts can confirm that this is not the first time this was reported. In previous cases, the first case in Kerala was reported in 2018 at Perambra in Kozhikode. That time, unfortunately, 17 persons were killed. That time, it was the health sector was not prepared for this. Kerala was totally caught off guard at that time. So almost 17 persons died at that time. And so far, 21 persons have died in the outbreaks that happened in 2018, 2019, 2021, 2023, and now this year. This year, the index first patient died, and he has reportedly consumed a fruit which is locally known. It's a pork plum, locally known as ambarenya, and so that is suspected to be the reason for this infection. But since even after so many cases, we are yet to confirm the real cause of transmission, whether this is really from consumption of fruits or any other in coming in contact with the other secretions of the bat from public places. We are still not very sure about that. But this time, I think that with this outbreak, we have this scare is slowly waning off because all have tested negative so far.
Absolutely. Like you rightly pointed out, the Kerala government is doing all that it can to ensure that there's no further outbreak. The concerned departments are also acting. Dr. Rajeev Jayadevan, again, like Jisha pointed out, Kerala saw the infection of Nipah cases, of course, in 2018, 19, 21, 23, and this year as well. If you can just help us understand what exactly causes this recurring Nipah outbreak, especially in the state of Kerala.
As we heard, this virus circulates freely in bats, and it is not a naturally occurring virus in man. So it periodically jumps to man wherever what we call there is an animal-man interface occurs. Now, that interface, as you heard Jisha say, could well be from consuming fruit that was half eaten by a bat, or fruit that contained the secretions of the bat. It could be reproductive secretions, urine or saliva of the bat. It could be from some other method of contamination of bat material onto what humans consume. So, but it's clearly due to the presence of the virus in the bats. That's what we are sure of. And for our viewers, for them to understand, this virus really does not kill bats. It is there in what a kind of bat called a fruit bat. These are large bats that are found almost all over India. And this virus has been found in many states in bats, but the detection has only occurred in Kerala and also in West Bengal. As you know, West Bengal is right next to Bangladesh, where a lot of cases have been reported with a close to 70% mortality, which means that if a person catches the infection, there's a 70% chance of dying. Now, the infection spreads from bat to man. That's the first patient. And this person could come into contact with others, say, for example, the caregivers, the healthcare workers, the spouse, close family members who are the patient's caregivers, and the virus can jump from man to man. So there are two steps to Nipah outbreak. One is the bat to man jump, and then the virus jumps from man to man. It's a man-to-man jump that's been curbed successfully in Kerala this time with just one case total. In spite of checking so many contacts, they all turned up negative. Again, from Bangladesh, where outbreaks are reported this year, they had 2 deaths, unfortunately. Both were isolated cases, and many contacts, close to 60 to 90 contacts, were tested negative. Last year, Bangladesh had 11 primary cases. That's the bat-to-man jump. And 3 people died because of 3 people got Nipah from their immediate contacts. So this it gives us a sense how the outbreaks occur. So the primary thing is to diagnose
Dr.
it properly.
Rajeev, you made a very interesting point there, that all the steps that are being taken by the government, they actually help in stopping the man-to-man infection, the man-to-man spread. But what about the bat-to-man spread? Dr. Ishwar Gilada, I just wanted to come in there about this point, because we talk a lot about the bat habitats. How does a community that actually is surrounded by such bat habitats protect itself, especially given the fact that these bats actually act as reservoirs of these viruses? So how exactly do these communities stay safe?
See, thank you very much for having me on the show in the panel of experts. Currently, what problem you are facing in Kerala, whether it's a Wayanad or Malappuram, they are the disturbance in ecological balance. If you see the last 40 years of infections, new infections coming, almost 70% infections are viral infections, because we have effective antibiotics for bacterial infection, we have antiparasitic for parasitic infection, we have antifungal for fungal infection, but we hardly have any antivirals. Secondly, most of the such viral infections are zoonotic. Zoonotic means they are coming from animal to human being. Whether you talk about SARS, whether you talk about bird flu, mad cow disease, Zika, Nipah, Ebola, or even HIV, monkeypox, they're all coming from animal to human beings. That means what is important is symbiosis, symbiotic relationship. If animal has their own environment to live, don't intrude that environment. If we are disturbing ecological balance, we get flooded with water. So I think human beings have to decide for our own selfish motto how much we are going to intrude in others' domain. And if we continue to do that, we are continue to face these problems. So today there are 10, 12 diseases, but tomorrow there'll be many. Till today, from Nipah, hardly less than 1,000 people have died. But these are only outbreaks. It can lead to a kind of a pandemic. They are working on vaccine, that Chadox 1, that is chimpanzee adenovirus derived vaccine at the Oxford, number 1, which is Nipah B. But the trials are on since January. They need to do fast track. At least those people who are in contact and communication with that index case, they can be given this vaccine. Currently, good thing is that no human case has come after that 14-year-old boy has died. So that is only good thing. So these are self-limiting outbreaks, and good that they are not becoming pandemic or epidemic. So, but when they can become, we don't know. So
Absolutely.
this is from a family of Paravixomyridae, from where we have mumps and measles, which are in n number in human beings. So from the same family, different viruses can come.
Right.
They can change their shapes. They can change their characteristic. They can attack animal to human being. They can have a conduit of a fruit. So all these things are possible, provided we are not going to their domain.
Right.
We can be saved. We do not know how much we can be saved, but we should stop going into domains of wild animals, forest, and ecology.
Absolutely. Dr. Gilada, very interesting point that you made there. The fact that this is just an isolated case right now does not mean that we can actually lay back and say that, well, it's not really serious, because when it can actually peak, when it can actually, increase, that again is a big question, and you never know with that. So that's exactly why the authorities as well are very careful about how they're dealing with these cases. They're, of course, isolating everyone that's been in close contact. Dr. Rajeev Jayadevan, Dr. Gilada here was, of course, talking about the treatment methodologies and all that. Can you help us understand what's the best treatment method right now? And also, have there been any effective vaccines or other effective treatment methods that have been developed of late?
There are no vaccines available for the Nipah virus, but there's something called monoclonal antibodies that are available. Now, these are available against a particular virus called the Hendra virus, which is similar to the Nipah virus that occurs in Australia. That particular virus occurs in horses, and from horses it has jumped to man, and about 57 people have actually contracted the disease. Now, they have developed this antibody in the lab that can attack this Hendra virus. And since Nipah is a close cousin of the Hendra virus, it is assumed that if this antibody is given early enough after exposure, the person might be helped. But we don't have any evidence on whether it actually works in a given patient, because giving the antibody as a preventive step is one thing, and giving it to a person who's already having an active brain infection is something else. So the data is out there. As Dr. Gilada said, there are no effective antivirals for this particular agent. And the priority is to minimize man-bat-human interaction. But that being said, bats are there everywhere. In fact, in my property in the center of the city, they come and visit my trees all night. So it's not possible to stay away from bats, but it's important for a couple of things to do. One is one must not go and scare away bats or hunt bats or try to kill them or trap them, because that increases the risk of a spillover. That is something that has happened before. Second is hunting of bats should not be done. That's occurred in Bangladesh. That's on record. But there's no record of such practices occurring in the areas where Nipah outbreaks occurred in India.
Right. Of course, thankfully that hasn't really happened in India, and one only hopes that, of course, that's not something, that's not the kind of adventure that people here really engage in, because that would really be dangerous. And like Dr. Gilada also pointed out, you never know when it actually proliferates into a pandemic. Jisha, before we wrap this discussion up, I'll come back to you. We've just got a couple of minutes on the broadcast. Of course, Kerala, because you've got recurring outbreaks in Kerala, it actually has developed a good methodology, a good SOP as far as the treatment of Nipah and also the reaction to Nipah virus outbreaks are concerned. Again, what are the lessons that other states can also learn right now? Because just help us understand, what does Kerala do immediately after there's an outbreak, and also what are the steps that it takes to ensure that the virus spread does not happen?
Yes, like I said, when the first outbreak was reported in 2018, Kerala was totally caught off guard. But that time, the excellent medical experts in our state was able to identify that this is not an ordinary viral infection. Remind you, the symptoms are very close to viral fever, so it was very difficult to identify. But we are very fortunate to have such excellent medical doctors here, who were able to identify, it's a suspect that there is something different here, and send this lab reports to NIV Pune for testing. And that's why before it spread to more and more areas, we were able to identify that this was Nipah in the first case. And second case onwards, the health department was especially very efficient in tackling this. And in fact, this helped in the identification, in the COVID outbreak also, because in 2018 we had this experience in 2018, especially the way we handled the spread of infection. A lot of people who were infected were actually health workers. So that set in some protocols, to prevent further infection. That really helped during the 2020 COVID outbreak. And after that, all other cases, especially after the outbreak, we were able to identify the cause of infection. In fact, in a barring one case, 1 year, all the cases ended with the index patient. After the 2018 the 17 deaths in 2018, only 1 or 2 deaths were reported in other outbreaks.
Right.
So there is a protocol which is in place to identify such cases, to do the proper testing, and also to isolate contact tracing. It's one thing which should specifically mention.
Absolutely.
Contact tracing is very efficient. Yeah, these are the measures that we.
Right, Jisha, like you rightly pointed out, proactiveness seems to be the formula here for the Kerala government, of course, to deal with such cases. And again, the reason why we're, of course, having this discussion today, viewers, is not just because this is, again, we're trying to be alarmists here, but again, it is something that you need to be aware about. It is something that it's actually out there. The outbreaks have been regular. Every couple of years, you're looking at these outbreaks, and it's better to be informed than actually not know about something before it becomes too late. Right, Dr. Rajeev Jayadevan, Dr. Ishwar Gilada, and Jisha, appreciate you joining us for this very special discussion. On that note, viewers, it's a wrap on this edition of the Bulletin. My colleague Shreya Tondial joins you with the urban debate on the other side.
Something should just sound remote.